Hi, y'all. So, 5 things every pregnant woman should buy during the pregnancy. I'm Dr. Fatu Forna. I'm an OBGYN who works to keep pregnant women safe here in the US and around the world. So, Black women, there are 5 critical things that I really think you must have to stay safe during pregnancy. And we're going to talk about about these things today. Number 1 is a blood pressure machine. Every single Black woman needs to buy a blood pressure machine, have it, take your blood pressure daily, know what your blood pressures are, write it down, be familiar with this. And this is important because Black women are at a higher risk of having hypertension and of having hypertensive complications of pregnancies. You'll hear them: the preeclampsia, pregnancy-induced hypertension, gestational hypertension. Hypertensive and cardiovascular conditions are the number 1 killer of Black women in the US. They're not the number 1 killer of all women, but of Black women, they are the number 1. Different racial groups have different risks, but the reason I'm going to be talking a lot about blood pressure is for this reason. There are automatic blood pressure machines available online. They're available at any of the drugstores or pharmacies. They're relatively inexpensive. So that's one thing that you must have. And I'll be talking later about the different blood pressure numbers so you're familiar with them. But what you must know is the one thing you should buy to keep safe during your pregnancy is a blood pressure machine. Number 2 is a water bottle. I know, I have a problem drinking water, and I had a tough time during my pregnancy, but a water bottle is critical. It keeps you on track. It helps you to stay hydrated. You have increased needs for water when you're pregnant. You need to drink about 8 to 12 glasses of water a day. And if you get a water bottle that kind of shows you what the numbers are, it helps you to make sure you're getting your water. It's very easy to get dehydrated when you're pregnant. You need water to make amniotic fluid. You need water to keep from getting contractions. Sometimes you just contract, and when you are dehydrated. Water helps the blood circulation. It helps eliminate the waste that your body makes during the pregnancy. So water is critical, and a water bottle is the number 2 thing you need to buy. The number 3 thing is sneakers, tennis shoes, really comfortable shoes for walking. It's daily exercise is very, very important for women, especially Black women during pregnancy. Even when you're planning to get pregnant, you need to get into that habit of walking every day, 30 minutes a day. When you get pregnant, you might not need to be able to keep the pace as fast as you were doing it before, but you must walk 30 minutes a day. Build that into your schedule. It minimizes your weight gain. It helps you stay flexible during the pregnancy. It helps with all those aches and pains that you have. You can be very physically active when you're pregnant. Women that were jogging before can keep jogging after. Women that were doing, moderate to vigorous exercise, you can continue that. You just need to make sure that you keep your balance. And you're not doing anything that'll increase your risks of falling. So walking at a minimum 30 minutes a day, that's something you should do all throughout pregnancy. Number 4 is a scale. A scale is very important so that you track your weight gain yourself. You're not just waiting for doctor's appointments to track your weight gain. It's very important during pregnancy that you put on weight, but not too much weight and not too little weight. And so there are different categories. If you were normal weight when you got pregnant, we typically recommend about 25 to 35 pounds of weight gain. If you're a little bit overweight, we only recommend about 15 to 25 pounds of weight gain during pregnancy. And if you were obese, then we only recommend about 10 to 20 pounds of weight gain during pregnancy. We don't want you losing weight during pregnancy. This is not the time to lose weight, but you need to have a scale and keep an eye on the amount of weight gain because the more weight you put on, the more complications, the more risk of diabetes during pregnancy, hypertension during pregnancy, and those are all things that can increase your risk. And then the 5th thing that you should get is a pregnancy journal or some kind of app that you can write on. we've heard about pregnancy brain. I had it myself when I was getting my babies. You forget stuff. There's important things you think about that you want to ask your doctor or your midwife during your visit, but you forget. So get a journal, a pregnancy journal, get an app, write those things down that you want to talk about during your visits with your doctor or your midwife. Write your blood pressure down. When you take your blood pressure daily, write it down. Write what your weight is. Probably check your weight once a week. Write that down. Write appointment notes, important things you discussed during your pregnancy. So those are really the 5 things that I think every pregnant woman, especially Black women, you need to have those things and buy those things for your pregnancy. So Black women, get these 5 important things and use them because we need you to survive and thrive.